Our purpose is to care for patients, their families, and one another. This can only happen with purpose and clear direction. We can change lives for the better, each person and every experience. Welcome to the Ardent Service Excellence Podcast. I'm Paul Kappelman, Ardent's Executive Vice President and Chief Operating Officer. This podcast was created to keep you and your teams informed, inspired, and invigorated.
This is Amanda Armstrong with your Connect to Purpose story. This story is from Harrington Cancer Center at BSA Health System in Amarillo, Texas. At the age of 71, Thomas Cole never imagined he would be diagnosed with breast cancer. However, in November of 2018, he was diagnosed with stage 2 non-aggressive infiltrating ductal carcinoma after noticing an abnormal lump on his left breast. He is thankful his wife urged him to be seen by a physician for early diagnosis and treatment. Mr. Cole had a radical mastectomy in December of 2018 and rang in the new year as a cancer survivor. Mr. Cole is now advocating for men with breast cancer in hopes to inform, educate, and bring awareness to the disease and how it can affect men. He says, "I feel like I have a responsibility to share my story. Part of my success is because of the early diagnosis."
Today we have on our podcast Ardent's Chief Medical Officer, Dr. F.J. Campbell. So welcome, F.J.
Good morning.
I want to talk to you about your use of service excellence techniques. When you were an ER physician practicing, what were some of the techniques you used?
You really want to show the patient that you're not distracted. And what I like about things like standard greeting and components of scripting, it helps set the stage. The patient knows that they are your only focus.
Anything in particular that you did to let them know that you were focused on them and create that great first impression when you walked in the room?
Definitely. The one thing that all emergency medicine patients have in common is that they're scared. So after I would figure out why the patient was in the emergency department, know how I was going to work them up, how I was going to treat their symptoms, I would ask them, what are you most worried about? And a wealth of information came from that, not the least of which was we got right to the core of what was making them scared. And simply having that conversation was therapeutic in and of itself. They were more trusting of me. They were more trusting of the treatment plan. They were more trusting of the process.
How do you think the standard greeting, in particular your introduction, helps you manage patients better?
They clearly had an understanding that I was only concentrating on them. I made good eye contact with them. I clearly sat down and addressed their concerns as they came up, and I gave them clear answers as a result. And when you have that trust, I mean, you've known the patient for all of 2 minutes at that point. You need to quickly gain their confidence and their trust that you are only concerned about them at that moment. And as a result, they were more confident to follow the treatment plan.
So there is a connection between service and them giving you a great score on your surveys and actual having a great outcome?
Patients are more likely to follow the treatment plan. They're more likely to follow their directions that they're going to have to follow after they leave the emergency department, after they leave the hospital, after they leave a physician's office, if they feel like they've had a good personal encounter with the physician, the nurses, and the staff. They believe in the people, they'll believe in the treatment plan.
Great. So how does that translate to what we're doing with Ardent Service Excellence and some of the key components of Ardent Service Excellence?
Two key parts of service excellence for us are bedside shift report and purposeful hourly rounding. When I think of bedside shift report, people want to be part of the process. If they're going to be affected by the outcomes, they want to be part of the process. Bedside shift report is when we pull the patient in twice a day with the staff and basically set the short-term goals. And at that point, the patient knows what to expect. The caregivers know the patient's concerned. It's a very clear way of focusing on what has to be done in the present. What I like about purposeful hourly rounding is it's actually being proactive to think about, all right, what are the things that are going to take us off that short-term plan? And these are things that don't have to simply happen at the bedside. These are about handoffs and looking for ways that things can go wrong. That can happen in any department. We have, with our IS department, when they're working with caregivers in the field, making sure that you're staying focused on clear communication and short-term goals makes the caregivers in the field feel comfortable with what's happening here at corporate. Thinking about, all right, what are the ways in which we can get off of our short-term plan? That's purpose for hourly rounding. That's the same thing as, while we're between our short-term goals, what do we have to look for to make sure we're staying on track? That can happen in any healthcare department.
From a physician standpoint, what changes do you believe will have outcomes and impact on the doctors who practice in our hospitals and see patients in our clinics throughout the country?
That's service excellence. And the fact of the matter is, service excellence really started taking off when we were publicly measuring patient satisfaction scores, or in the hospital, HCAHPS scores. The hospitalists, the physicians working primarily in the hospital, they have a jump on their peers in the ambulatory space because they know their work is in part judged on how we do on patient satisfaction scores. The same thing's really about to take off in the ambulatory space, where we should have really good physician engagement there, because as they see their patient satisfaction scores being more public through things like CGCAPs, their office is also being judged, they're going to go through that same kind of catalytic process of realizing that their patient satisfaction scores are going to be visible, and therefore they're going to be judged on them, and they're going to start seeing the benefits to their patients when they pay attention to those results.
Okay, so complete this sentence for me. When executed well throughout our facilities and clinic, a culture of service excellence
leads to better patient outcomes.
Thank you very much, Dr. F.J. Campbell. Thank you to our guests who joined us today and shared their stories and insights. And thank you for listening. Ardent Service Excellence was designed for each and every one of us. We all have the power to make a difference and impact lives. Let's stay connected to our purpose of caring for others, our patients, their families, and one another.